Your question about public transport, we will engage with everybody and issue instructions. Among others, in our space, we've got PRASA, which will undergo and perform sanitization in all our trains. Of course, the social distancing will affect us en masse in terms of trains and taxis. So that includes education in relation to this, but over and above, random testing will be applied in all the taxi ranks and also in the trains.
And from the retail sector, they're optimistic that they can work on retaining their supply lines. Of course, we need to ensure that there's no panic buying, because that then leads to further panic in the retail sector. But what has been strong and important for us is that we have a domestic industrial capability to supply the basic goods, basic food goods, basic consumer goods, and so we're setting up and making sure that those don't get disrupted.
Where employees are required to be quarantined as a result of having traveled into the different countries or coming into contact with the virus. Well, various types of leaves, we are going to be talking about them. If employees contract the COVID-19 during the course of performing their duties, they will have to be compensated.
Of stopping the breathalyzer. Stopping the breathalyzer doesn't mean we stop checking you that you are drunk. That will continue. We'll go straight to a blood test. There will be nurses and doctors on the field where we have roadblocks and make sure that that continues. It happens.
But essentially what we're looking at is getting industries, every sector, to work on plans to limit the spread and avoid the spread of the virus at the workplace. So social distance provisions around canteens, clocking in arrangements, all of those will be rapidly worked through after the NEDLAC meeting. We're looking at industrial hygiene and mass cleaning of surfaces.